Hello, my name is Lorne Brown. I'm a doctor of Chinese medicine and also a clinical hypnotherapist, and I'm a fellow of the American Board of Oriental Reproductive Medicine. So yes, it is something that has been observed, and the evidence is showing that women in their early 40s and beyond are having more challenges and difficulties conceiving, especially using IVF. The success rates have been fairly low. What my theory is, or what we're seeing from the Chinese medicine perspective, is that we as a people here in North America, at least in Canada and the United States, are aging prematurely. We're aging at an accelerated rate, and there's this biological potential and a chronological age that we have. And right now, the Western medical science is focusing just on the chronological age, which we can't do anything about. How many times the Earth has gone around the sun will not change for a woman. But not all 40-year-old women are equal. And what I see clinically and what I see in some of the data looking at other age-related or age-associated diseases are that based on our diet, based on our lifestyle, based on stress, and even based on our relationships, our connections to our spouses and our community and our families, can affect the overall lifespan of the human being and the health of the human being. And so what I'm suggesting and stating is through better diet, through better lifestyle changes, tools for reducing stress, and taking time to connect and develop those relationships, we can slow down this aging process and even reverse it. And we've seen this in other age-related diseases, which we used to think were related to age, which we now know are related to diet, lifestyle, and stress. For example, high blood pressure, heart disease, dementia, Alzheimer's, osteoporosis, often once thought of diseases of age, are now known as diseases of certain lifestyles. So it is on a case-by-case basis, and this is a really good and interesting question, because what are we seeing clinically? So we are seeing women, for example, we've seen women that are 42, 43, diagnosed with high FSH, diagnosed with low AMH, so we're seeing there what's considered a low ovarian reserve, have done an IVF and have not responded well, needed to be canceled their cycle. And then we go on, they change their diet, and this diet is getting rid of the refined processed foods, the sugars, eating a whole foods diet that's not processed, eating good carbs, lots of fruits and vegetables, whole grains, legumes, getting your fats from nuts and seeds. That's the diet part. Finding time to exercise appropriately, changing the way they react to stress, not just the stress. So making all these positive changes. And it can be 6 months to a year. So now they're a year older and they go into the IVF and they respond so much better and they get a baby out of it. So that kind of puts a hole in the theory that it's just age that affects fertility. Now, I want to be clear that age is one of the issues. In Chinese medicine too, age is an issue that affects your fertility. Chinese medicine, they discuss the reproductive span for a woman to be about up to 49. So if she's healthy, ovulating regularly, she has the potential, and the key word here is potential, to conceive and give birth. What we're seeing in at least Canada, United States, and industrialized nations is that we are not making it to that time of having children in our late 40s. We're having difficulties even in our early 40s. And that's because we have this potential, but we're not achieving our potential. And again, just to take this where there's more data, more science, is when we're looking at other diseases like Alzheimer's, depression, osteoporosis, heart disease, cancer, diabetes, we're also getting these in our 70s and our 80s. But we're able to reverse these. We've seen this in certain cultures, in certain studies. The Okinawans in Japan, the centenarians, they have very little incidence of these diseases, and they have the most people 100 years plus in that culture. And they don't have the diseases like we have here in the West, but when they introduce our lifestyle, they get the same diseases we do. And so the theory here is that we have this biological potential to live to 100 plus healthy and to reproduce to at least our mid-40s to late 40s. But because we're not living that way, we're not achieving that potential. So we're not reaching our peak fertility. Okay. And the theory I have, there's other REIs, doctors that share this theory, is that the eggs that the women have before they're born, they have them all in utero, they're suspended in time. So this quality is set by birth. And what can change is the environment The environment in which these eggs, these follicles get recruited, and the last 4 months is very crucial, we know from Western science, but it's like at least a 1-year recruitment process. And if this environment is inadequate, then the end result of that egg quality is not optimized. It becomes poor. So right now, from the science perspective, the way I've been seeing it is we're looking at the eggs and we're saying, oh, there's DNA damage, they're getting old, they're not very great. But these primordial follicles, which we can't see because we have to take out the ovaries and cut the ovaries in half to see these are set in time. But when they're recruited, if the environment, there's not good blood flow, the hormones aren't balanced, if there's toxins in this environment, if they're lacking nutrition, so there's deficiencies, then they don't reach their peak potential. And the best analogy I have is, I share this often with clients and patients. If you have a plant at home and you neglect it, it can look brown and dried and worse for wear, basically ready for the garbage. But oftentimes you can just add water, and within a few days that plant will regain its green color and it will become firm again. It will even go on to give off fruits and flowers. Now, we didn't do anything to the roots. All we did is change the environment in which the roots were in, and that plant was able to reach its peak potential. And so, using that analogy, it's a lot of women and men, they're not reaching their peak potential because of, again, our diet, our lifestyle, our stress in our lives. There has not been any studies with Chinese medicine turning back the clock, per se. There have been studies, though, to talk about this theory. There's a study, there's been studies using the hormone DHEA, where they've restored women's ovarian function, where they had a low ovarian reserve, and again, poor responders to IVF. And some of these women take DHEA, and then all of a sudden they have a better response to IVF and have healthy babies. There's a recent study in mice using coenzyme Q10, another supplement, which increases basically the mitochondria function in the cell. Okay, so that's like the battery of the cell. And so as we age, as the body ages, these mitochondria they wear out. And so from a fertility perspective, if the mitochondria are wearing out, then we have poor egg quality. And by giving these, in this study, they took retired breeder mice and injected them with coenzyme Q10 and some other substances, and they returned back to their reproductive youth, and they were able to go on, and the mice were also of good health. So we already know there's a theory, and we've seen in some animal studies and in human studies where we've seen that women that were diagnosed as old, advanced maternal age, or low ovarian reserve, or premature ovarian failure have returned back to reproductive potential. So currently, Western medicine discusses the issues with the decline in fertility after 35 and a much bigger decrease in fertility after 40. In Chinese medicine, we have some common ground there. They say the women average age in cycles of 7 years in average. And so at age 35, it talks about a decline in fertility, and then from age 42 to 49, a rapid decline. Where they differentiate is Chinese medicine does discuss that women can still have the potential to conceive up to age 49. So, for the women being informed in my practice, they've come to seek me out. So the majority of the women I see are fairly well informed. They're quite researched. But when I'm out in public and talk to people that are not aware or haven't run into fertility issues, there's a lot of people have this sense that they can have children whenever they want. The media, People magazine, showing celebrities having children later in life has misled the public, and a lot of women think with technology like IVF that they can have children later on. For example, I had a woman that came to me just recently at age 45 that hasn't found her partner yet, and she wanted to freeze her eggs for later. And right now in 2012, we don't have good success or any success freezing 45-year-old women's eggs to be used later. So, in the last 10 years, it's improved. When doctors give news that they don't think the couple have a chance of conceiving, they weren't very good at delivering or communicating this information. They definitely are getting better, and there's still lots of room for improvement. But, it's just the way the medical system was, or how doctors were trained. There was this standoffish, there's this relationship, patient-doctor relationship, and They just don't get emotionally involved, and that's their paradigm. That's how the current medical system has been. In Chinese medicine, there's this connection with the patient you're seeing. You have to look into their eyes, and before you needle or acupuncture a person, your soul has to connect with their soul, they say in Chinese medicine. It's kind of an expression. And so when we see couples after they've been to their REIs, the IVF clinics, often they're quite crushed because nobody wants to hear no, right? So nobody wants it to be told it's impossible, first of all. And so, ethically, these doctors do need to share with patients, the stats show for us that we can't help you. And it would be unethical to take your 10, 15,000 and put you at risk for an IVF, knowing that you're probably not going to have a child. So I understand where the medical doctors are coming from, because they don't think they can help the person or couple. And ethically, we wouldn't want doctors to be taking couples' money and putting them at risk, knowing in their hearts that they don't believe they can help them. However, we need to find better ways to communicate to these couples, and they need time to process, and we need to do a better job at doing that. So often they'll get the information from their IVF clinic, and they'll come to our clinic in tears, and then we're able to review it and give them a little different perspective on it and explain what that means. Because once they hear you have low ovarian reserve or premature ovarian failure, or you have less than 1% chances of conceiving, they don't hear everything. It's kind of like that Charlie Brown cartoon, wah, wah, wah. They don't hear anything anymore from the doctor, and it's shell shock, and they need time to process it. There is a processing time. And so I think we need to do a little bit more. We need to spend more time with the couples, and they need more empathy, and they need time to have their questions answered. And I think the clinics are starting to do a better job, and a lot of them are integrating with Chinese medicine doctors. And